think we should start discussing the government interference impeding healthcare. But, do you want to describe, you have in general, just kind of an overview to start with the root causes of the healthcare crisis to the listeners from your perspective as a clinician, and then we can move into specifically the government interference.
Sure. Well, I talk about government and we all have different views, right? Especially after yesterday. But the point being, though, is that a government serves a lot of roles, but I don't think that government is perceived by most people as being the most efficient provider of services and goods, right? And I think it's important to have partnerships with government and for government to do oversight, right? They're really there to keep us safe and protect citizens, right? But the free market and free enterprise, I think, is what makes this country great. And if you look at systems around the world, when it's a completely government run, it's very inefficient, and ultimately you end up getting a second tier. Right? So I have colleagues in Europe, and most of them are in the public hospitals during the day, but then about 5 o'clock they go and they open their little office and see patients privately, because people don't want to wait a year like our Canadian friends, right? For that. So I think Americans won't put up with that. I think, in many respects, we're a little spoiled. We are the richest country in the world, and we have great health care, but I don't think that the government is the one we should look toward. And certainly, if you've ever worked in a VA hospital like I have when I was a resident, and I used to moonlight in the emergency room as an ER doctor, and I can tell you that it is not a very efficient place, the VA. So why should we have our whole system like that? And for the book, I myself read and researched and learned a lot. So several of the books I read, including one called, there's so many I'm trying to think. The one I'm thinking of is The Case for Free Market Healthcare. So it's a colleague of mine, another orthopedic surgeon, actually another Cuban-American surgeon, who wrote the foreword to my book. And he outlines the arguments about why the government should not be the primary healthcare giver. And we don't have time to go into all the details, but it is really not, let the free market, quality, efficiency, all of those things which are great for healthcare like any other business, will ultimately win out. And the more regulations you have, the more red tape, all that's going to do is increase cost and put barriers between myself and my patients. And there really is no need for that.